Hello, everyone. My name is Jorge Ovando, and this is Nursing 505 Healthcare Systems and Health Policy. For this presentation, I'm going to walk through the final decision I made after reviewing the problem, the evidence, and the policy options we explored throughout this course. Mental health access continues to be a serious issue in California, and it impacts patients, clinicians, and the healthcare system as a whole. Over the past several weeks, I evaluated three policy approaches that could help address this problem: expanding telehealth mental health services, increasing funding and incentives for the mental health workforce, and integrated mental health services directly into primary care settings. Each of the policies has clear strengths, and none of them are unrealistic or ineffective on their own. However, this assignment required me to go beyond identifying good ideas. It pushed me to think about outcomes, implementation, and long term impact. That meant asking practical questions like which policy is most likely to improve access quickly, which one supports clinicians rather than adding more burden, and which option has the strongest chance of getting support from both providers and policymakers. Mental health challenges often don't show up in obvious ways. Many patients come into clinic with physical complaints like fatigue, headache, chronic pain, or sleep problems, when the underlying issue is actually anxiety, depression, or ongoing stress. In many cases, the patients never make it to the mental health specialist because of long wait times, costs, lack of insurance coverage, or stigma. As a result, primary care providers are already dealing with mental health concerns every day, even if the system is not designed to support them. After weighing the outcomes and considering real world implementation, I choose a policy of integrating mental health services into primary care settings. In the rest of this presentation, I'll explain why I choose this policy, why I believe is the best choice for healthcare clinicians, and what I see as the main selling point that makes it a priority for advocacy and health policy development. So, why I choose this policy? The main reason I choose integration of mental health into primary care is because it meets patients where they already are. Primary care is often the first and sometimes the only point of contact um, patients have with the healthcare system. By engaging and embracing mental health screening, brief interventions, and referral pathways into routine primary care visits, access improves without requiring patients to navigate completely a different system. Compared to expanding telehealth alone, integration addresses both access and continuity of care. Telehealth is helpful, especially in rural areas, but it still requires patients to recognize the need for mental health care and take an extra step to seek it out. Integrated care reduces the barrier by making mental health a routine part of healthcare rather than something separate or optional. When compared to workforce expansion policies, integration also offers more immediate impact. Training and hiring new mental health professionals is essential, but it takes time. Integrated models make better use of existing clinicians while gradually expanding support roles like care coordinators, behavioral health consultants, and social workers. Most importantly, this policy aligns with how healthcare actually functions day to day. Patients trust their primary care providers. When mental health conversions happen in those familiar settings, stigma decreases and engagement improves. So now, the question is, and why this is the best choice for healthcare clinicians? Well, uh, from a clinician perspective, integrated mental health care offers meaningful support rather than additional workload. Many primary care providers already feel overwhelmed by the number of issues they are expected to manage in limited appointment times. Untreated mental health conditions often complicate chronic disease management, increase repeat visit, and contribute to burnout. Integrated care models provide clinicians with tools, screening protocols, and teamwork support. This might include access to behavioral health specialists for consultation, shared care plans, or warm handoffs during visits. Instead of managing mental health concerns alone, clinicians becomes part of the team. This also improves efficiency. When mental health issues are identified early, patients are less likely to rely on emergency departments or crisis service later. That reduces the strain on clinicians working in high acuity settings and allows care to be delivered in a more appropriate environment. Clinicians are more likely to support policies that improve patient outcomes while also improving workflow and job satisfaction. Integrated care does both. It acknowledges the reality that the reality of clinicians they what they face every day and provides a structure rather than just adding more pressure. So it helps them to have an easier job and at the same time to be able to support the patient in a better way to be more effective. Anticipated outcomes. If this policy were implemented effectively, several outcomes could be expected. First, access to mental health services will increase, specifically for patients who might not otherwise seek care. Um, Screening will identify issues earlier, allowing for timely intervention. So if it becomes something that is a routine, something that happens more often, it can really be useful as for clinicians and at the same time for the patient. Second, patient outcomes will likely improve. Treating mental health alongside physical health leads to better management of chronic conditions, improve medication um, to the whole treatment, and higher patient satisfaction. Third, healthcare costs could decrease over time, which is very important. While there might be upfront investment costs, integrated care reduces emergency visit, hospitalization, and repeated appointments caused by untreated mental health conditions. There are also risks to consider, though. Without proper funding and training, integration could place additional strain on primary care clinics. That is why implementation must include reimbursement alignment, workforce support, and clear care coordination guidelines. When done correctly, the benefits outweigh the risk. Now, the selling point for advocating this policy and to develop this policy, um, the strongest selling point for this policy is that it improves access without requiring patients to change behavior or overcome additional barriers. Instead of asking patients to navigate a complex mental health system, the system adapts to them. So you bring them what they need. Um, the policy is also appealing to a wide range of stakeholders. Patients benefit from easier access to it, from easier access and reduces stigma. So it becomes more natural for everyone. Clinicians benefit from team-based support. Health systems benefit from improved outcomes and cost control. Policymakers benefit from scalable solutions that aligns with existing care structures. From a standpoint in which you want to push for this, integration reframes mental health as a standard component of healthcare, not a, not a specialty service reserved for crisis situation. That's huge right there. That framing, the frame, this kind of framing makes it easier to build public and political support. Just to normalize something that should be normal for everyone, instead of make it more difficult as if it wouldn't be normal for everyone. Like if it's something special, but it's not. So making it part of the system will switch the culture. Will make a click on the culture. So more people can get access to mental health. Uh, Now, in conclusion, after thinking about all the outcomes and evaluating feasibility, and considering the perspectives of patients and clinicians, integrating mental health services into primary care is a policy I would choose to support. It addresses access, supports providers, and offers, you know, improvement to the healthcare delivery. Mental health does not exist in isolation, and our policies should reflect the reality by embracing mental health into everyday care. We move forward looking into a system that is more responsive, more open for everyone, and effective for everyone involved. So, trying to assist and trying to help these patients, um, is not is not a gift that you want to give to people. It's a right. Mental health is also something that we need to care about, and I don't think we are doing a good job in treating people with mental health concerns. Therefore, I believe that this policy is a solution for better. I believe that this policy will improve the quality of life of many Americans, and it will drastically change in a positive way the way we treat people and the way we treat healthcare. Thank you so much for your time, and Merry Christmas.